We are going to just wait 1 or 2 more minutes to get started, but thanks for joining us, and we look forward to sharing some information about this process with you and hearing your questions. So just hang tight and we'll get started shortly. Okay, good afternoon, everyone. Thank you for joining this webinar. Today we'll be talking about how to submit your intervention for review to the SNAP-Ed Toolkit. Just a brief overview of where we're going today. We are going to offer an overview of SNAP-Ed and the SNAP-Ed Toolkit. Those slides were developed by our colleague Lisa Mays. However, since she's not back, since she's currently out of the office, my colleague Daniela will be presenting those. I'll be providing a brief overview of how more of the logistics and mechanics of how to submit your intervention, and then Tracy will be providing some thoughts and tips on how to apply the RE-AIM framework to your intervention. And we'll try to leave lots of time for Q&A at the end. Also, just to go over some housekeeping before we get started, we're going to be using the Q&A function primarily to get your questions to us. So while there is a chat function, we'll really only be using it to share additional links or resources throughout the webinar. So if you have a question, please share that through the Q&A. We will be responding to some of those questions through the chat or through the Q&A box, so everyone will see those responses as well as the question. However, if there are some that are more technical or that warrant a little bit more discussion, we'll save those to the end during the Q&A section. So if you don't see a response to your question immediately, hang tight. We'll get to it at the Q&A section and address it as best as we can. We are recording this webinar, so if you want to revisit it, you can go back to the SNAP-Ed Toolkit website and watch it at a later date, or share it with folks that you couldn't attend today. And lastly, as a participant, you are just joining in listen-only mode. So again, if you have a question, please feel free to submit that to the Q&A box, since we won't be able to hear you. So without further ado, we'll get started, and I'll turn it over to Daniela.
Hi, everyone. My name is Daniela Uslin, and I've worked at UNC for over 6 years implementing our SNAP-Ed program. I will be presenting today's slides in lieu of Lisa Mays from the USDA due to the government shutdown. Because Lisa is unable to join us and represent FNS, I cannot extrapolate the slide content. If you have questions on this portion of the presentation, we will be happy to share with Lisa once the government reopens. So what is SNAP-Ed? SNAP-Ed stands for the Supplemental Nutrition Assistance Program Education and is the nutrition education component of SNAP. The goals of SNAP-Ed are to improve the likelihood that persons eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines for Americans. Section 28 of the Food and Nutrition Act of 2008 states that SNAP-Ed programs must be evidence-based and use multiple strategies, including individual and group-based nutrition education, comprehensive multi-level interventions, and community and public health approaches. The SNAP-Ed Toolkit was developed to serve as a one-stop shop for SNAP-Ed stakeholders. It can be accessed via snapedtoolkit.org and features an interactive version of the SNAP-Ed evaluation framework, training resources, and a searchable database of SNAP-Ed interventions with various levels of evidence, approaches, and settings. So that brings us to the SNAP-Ed intervention review, which determines which SNAP-Ed interventions will be included on the Toolkit website. In 2018, there were 88 interventions that were carefully reviewed and included on the Toolkit website. 2 years earlier, the USDA convened the SNAP-Ed Toolkit Workgroup, who was charged with increasing the selection of interventions that fit state-specific SNAP-Ed needs, increasing innovation by encouraging adoption of interventions which reflect the most up-to-date research, and improving the transparency of the review process and criteria for inclusion. This year, UNC, in partnership with the SNAP-Ed Toolkit Workgroup, will be managing the intervention submission process according to the following timeline. On January 7th, the online submission portal opened. The submission portal will close on March 1st, so all interventions must be submitted by this time. On May 10th, all interventions will be reviewed and decisions will be announced. This summer, those selected interventions will be posted on the SNAP-Ed Toolkit website. Now I will hand back the presentation to Claire, who will go over the intervention submission process.
Great. So as Daniela mentioned, during the last call for interventions, we had folks submit paper applications through email or electronically. So this year, to streamline the process and hopefully make it easier for applicants to know which components are required and to make sure your application is complete before you submit it, we moved this process onto an online submission portal. We had about 10 SNAP-Ed implementers and others join us for a pilot of the submission portal last December. And so I just want to share a few quick tips and best practices about how to navigate through this portal, just so that you feel confident taking your application, maybe drafted in a Word document or in a PDF document, and bringing it into the online submission form. So if there are any questions about what I review, or if there are other issues or questions that you want to explore, feel free to chat those into the Q&A box so we can talk about those during the Q&A. So to get started, the first thing that you're going to do is request a link to the submission form. We are using Qualtrics to host the application. So what this will do is this form will automatically send you an email which will contain your unique link to the application. The unique link is important because you'll be able to go back and forth to the application, so you don't have to complete it in one sitting. But to get back and to save your work, you'll have to use that unique link for you. So you can visit the SNAP-Ed Toolkit website and head to the Submit an Intervention page. So you'll see this form at the bottom of that page, and you'll just enter your first name, your last name, and your email address. And within a few minutes, you'll get that email directly to your email address with the unique link. If you are submitting more than one intervention for your organization, please request one link per intervention, as they are unique applications. The email that you'll get will look something like this. We tried to link a few helpful resources in the email, including this webinar. There's also a link to the PDF submission form. So if you want to get a sense of what kind of questions will be asked to help you start thinking about how to address them, you can download that and actually preview it before you get into it. And then the link to get to your survey will actually be at the bottom of the email, which is highlighted here. As I mentioned, you'll be able to return to your application using this link, and you can start and pause your application as many times as needed up until the March 1st deadline. To develop the online application, we took the PDF and really tried to convert the PDF form into Qualtrics to look as identical as possible. So we tried to keep the same order of selection of response options, use the same language. So it should look pretty much identical. There were a few questions, however, that we had to split apart based on how they were formatted in the PDF. And so those questions are questions 14 and 18. So you'll see on the left here, this is how it will look in the PDF, and on the right, it'll actually be split into 14A and 14B. Everything else looks pretty similar. There are a few tools that help you navigate through the application. So one is the progress bar, which is at the top. The numbers will stay at 0 and 100, but the orange bar will move forward based on how far you are in the application. And then there are navigation arrows at the bottom of the form, which allow you to move back if you need to, as well as advance forward. There are character limits for most of the questions, so you'll see how many characters you will be able to include for that response. And then there will, Qualtrics will actually give you the characters remaining at the bottom here. If you are copying and pasting text from a Word document or PDF, please make sure all text is included in the word count. And this is really important because if you had 510 characters in a Word document and paste it over, only 500 characters will be pasted into that box. So just be mindful of that and just do a double check as you're moving text over. And again, this characters remaining field will show you how many characters you have remaining for that box. All required questions are indicated by an asterisk in both the PDF and the online submission form. And if you do not respond to a required question, it will actually prevent you from moving forward in your application. So again, using those navigation arrows, you'll only be able to advance through the application once you address all of the required questions. So those are kind of my high-level tips, and I see we got a few questions, so we can get into those during the Q&A. But I'm definitely curious to see how folks are feeling about the application portal, and I'm happy to troubleshoot anything any issues with that here or later. So now I'm going to hand it over to my colleague Tracy, who is going to be talking about kind of how to think about the application of REAIM to your answers to the application questions. So Tracy, feel free to take over from here.
Great, thanks so much, Claire. Good afternoon, everyone. I am going to spend some time this afternoon discussing the application of REAIM to your intervention. And we're doing this because the REAIM framework is going to be used to guide the review and discussion of the submitted interventions. Before we get into REAIM, I first just wanted to share some overall or big picture points around your submission. As you work on the intervention submission form, we'd encourage you to make sure that you share information around how your intervention was developed, how it was tailored or designed to reach your intended audience, and how its success or effectiveness was evaluated. We also wanted to briefly touch on the 3 evidence-based approaches or categories for interventions in the toolkit. These classifications include research tested, practice tested, and emerging. And the categories vary based on the scientific rigor, evaluation outcomes, research translation, and degree of innovation. And having interventions in each of these categories is important for the toolkit in terms of building and expanding the knowledge base of effective practices. So we really encourage the application of interventions across these 3 categories. So we're going to first pause here for a second and check in to see how familiar everyone is with REAIM. There should be a poll that's going to come up, and we're just asking you, if you can, to select the answer choice that best reflects your current knowledge of REAIM. So we'll give it a few seconds in order for people to respond to the poll. Great. So I think everyone's able to see the poll results, but it's good to see that we have about half that have some idea about what REAIM is, but also not a problem if people are less familiar with it. We'll share some resources at the end of the presentation in terms of additional training on REAIM in case it's something that you might be less familiar with. So REAIM was first proposed as a framework for evaluating health promotion interventions back in 1999 by Dr. Glasgow and colleagues at Kaiser Permanente, Colorado. And it's a set of standard criteria that focus attention on key factors or dimensions important for public health interventions. And these dimensions include reach, effectiveness, adoption, implementation, and maintenance. We'll spend some time with each of the REAIM dimensions. We'll first provide you with some background information on the dimension, and then we'll share some questions that were designed to help you fully address each dimension in your intervention submission. So if you've had a chance to look at the intervention submission form, you may have noticed that the questions are grouped into sections based on REAIM. So we'll discuss the dimensions in the same order as they are included in the submission form, and we'll start first with reach. So reach is defined as the number or percentage of people who are exposed to the intervention or people whose health may be improved as a result of the intervention. It's often reported as the total number of people affected or exposed to the intervention, but in order to determine the percentage of people reached, you'll need to address two components. First, answering the question, how many people would ideally be exposed to the intervention, is the denominator in the reach calculation. And then answering the question, how many people are actually exposed, is the numerator. So the percentage of the target population that is actually exposed to the intervention also measures reach. And within the reach dimension, it's important to examine the characteristics between those actually exposed versus those ideally exposed, as well as those actually exposed versus the whole population. And these comparisons help check if the intervention reaches those that are most vulnerable or at risk, and thus, therefore, helping to ensure that the intervention addresses health disparities and works towards health equity. So when working on the reach section in your submission form, these questions can help you make sure that you have complete answers. They can serve as a check to make sure you've included important details, such as how your intervention development process worked to ensure it was appropriate for the target population, as well as how your intervention reached your target population. So when you're working on your intervention submission form, we'd encourage you to look back at these questions, and we'd also encourage you to look at take a look at the intervention scoring tool that will be used by reviewers. So the next dimension of REAIM is effectiveness. And effectiveness is defined as how well the intervention affects the change on the intended outcomes and whether or not there are unanticipated outcomes. And intended outcomes can include targeted and broader outcomes, and unanticipated outcomes may be positive or negative. Measuring effectiveness answers the question, what is the impact of the intervention on intended outcomes, including positive or negative unanticipated consequences? And within the effectiveness dimension, it's important to be clear about the outcomes that the intervention was trying to achieve. And these outcomes would have been specified when developing the intervention and when planning upfront for its evaluation. So the effectiveness section of the intervention submission form is the most extensive in terms of question and content to share about your intervention. So it's going to be important here to include enough detail to help the reviewer understand things like how the acceptability of your intervention was examined, how intended outcomes were achieved, and how the evaluation was conducted. So including relevant attachments that support these pieces is strongly recommended. You'll essentially want to give the reviewers all the evidence needed for them to look at the impact of your intervention on the intended outcomes. And when answering some of the questions in the effectiveness section, we'd encourage you to use the SNAP-Ed evaluation framework. There's an interactive version of this framework that's found on the SNAP-Ed Toolkit website. The address is shown here. And we're going to walk through one example next to describe how the framework can be used for one question in the submission form. So question 22 in the intervention submission form asks, what intended outcomes were achieved and to what extent? And if applicable, for each indicator of the SNAP-Ed evaluation framework that this intervention addressed, which metric or metrics from the companion interpretive guide changed? So here we've used the Rethink Your Drink intervention that's included in the toolkit as an example. And the intervention provides nutrition education and recommendations for improving overall health, but specifically emphasizes reducing intake of soda, energy drinks, and sports drinks. So one indicator from the SNAP-Ed evaluation that this intervention addresses is ST1, or healthy eating. And we can then use the interactive framework and interpretive guide to learn more about the outcome measures associated with the ST1 indicator, one of which is the ST1L, or drink water instead of sugary beverages. So the next piece of question 22 asks about the extent achieved, which is where evidence showing decreased consumption of sugary beverages is included. So this screenshot shows what it would look like when the Rethink Your Drink information is entered into the online intervention submission form. And while we just focused on one outcome here as an example, interventions will likely have more than one outcome to include here. So we wanted to pause here before getting into the next REAM dimension just to check on to see how helpful the example was in explaining question 22. So when the poll comes up, if you can please choose an answer choice that best reflects your thoughts. Great, thanks everyone. So it looks like about half felt pretty good about it, but we could also use to provide some more information. So that's helpful to know, and this may be something that we could address. We'll talk a little bit more later about the office hours that we're providing, but this could be something that we could either address during one of those or else provide some other information via email or whatnot. So the next REAM dimension is adoption, and adoption is defined as the characteristics and number of settings adopting the intervention. And these settings could include schools, work sites, child care facilities, retail, or other places. It's essentially any place or entity where the intervention can be implemented and where there's an opportunity to connect with the target population. And measuring adoption is similar to what we discussed for REACH. Answering the question, how many settings could adopt the intervention, is the denominator in the adoption calculation. And answering the question, how many settings actually adopt the intervention, is the numerator. Therefore, the percentage of settings that actually adopt the intervention measures adoption. It's also important with adoption to examine if there are differences between the settings that do and do not adopt the intervention. Some of the characteristics you could compare between the settings could include the size, type, capacity, or culture. You could also look at demographics within the settings and compare those. Essentially, you're trying to understand if the settings that actually adopt the intervention are representative of the settings that could adopt it. And for the adoption section of the submission form, these questions can help make sure that you've covered important aspects of adoption. Answering them can help give reviewers more detailed information on the settings or partners involved in your intervention, how these settings or partners were engaged, and how they effectively reached the SNAP-Ed target audience. The next REAM dimension is implementation, which is defined as the extent to which the intervention is delivered as intended or designed. To measure implementation, the activities that are required to implement the intervention are examined, and these required activities are the key components that must be completed for the intervention to be effective. And the activities may be based on theory, a logical sequence of activities, and evidence-based strategies. To examine if these activities are occurring as intended, process measures that capture data on each of these activities are used. And within the implementation dimension, it's important to look at the time it takes to implement the intervention and if the implementation costs are compatible with available resources. Costs for implementation could include those for staff skills development and training, as well as materials or costs to participants. And the complexity of the intervention also needs to be considered to check if all the steps for implementation are reasonable and feasible to implement as intended. And for the implementation section of the submission form, descriptive information with sufficient detail is important. You want to make sure that the implementation instructions and materials are clear and easy to follow, and supporting materials that provide additional details as well as evidence that the intervention was implemented with fidelity are also important. So you can use the questions here that to help check that you've included all the necessary information for the review. And the final dimension of REAIM is maintenance, which can be measured at both the individual and setting levels, and it includes the long-term effects of the intervention and its sustainability. Measuring maintenance is determined from examining if the intervention produces lasting effects. So examining if there's consistent support from the staff, settings, and partners involved is also needed to ensure the longevity of the intervention. And within the maintenance dimension, it's important to consider if there's adequate funding and partner engagement. And partner engagement can help raise community awareness, conduct ongoing outreach, promote sustainability, and identify and apply for new sources of funding. For the maintenance section of the intervention submission form, information on a range of factors influencing the maintenance of your intervention should be addressed. Some of these factors include describing modifications to the intervention, as well as showing consistent support from involved organizations. And you'll also want to include evidence showing maintenance of the outcomes if it's available. The questions listed here, along with your review of the intervention scoring tool, can help you to make sure that you've included the necessary information for the intervention review. So before wrapping things up, we wanted just to pause to see if there's a particular REAM dimension or more than one dimension that's still not clear. So definitely answer honestly and check all that apply so that we can provide additional support to help ensure that there's good understanding of the dimensions. Great. So this will be helpful information for us to have. It's good to see that people understand them for the most part, but we could also touch on some of the ones that people may still need more information on. So thanks, everyone. So we wanted to also touch on some additional resources that are available. There's the REAIM website that's the first bullet listed here. There's also an online training on REAIM. It's just about an hour long, and you can get to that through the SnapEd Toolkit website under the training tab. There's also a one-page table on REAIM that's the PDF that's included here, and then a link to the SnapEd evaluation framework. And if you have particular questions, you can definitely email us at the snapedtoolkit@unc.edu. And then I mentioned earlier that we'll host office hours every Thursday. They started last Thursday, and they'll continue until the end of February from 3 to 4 Eastern Time. And these are accessible via Zoom, and the information is included here, and we'll also send that out via email. And we wanted to acknowledge the efforts and hard work of the SnapEd Toolkit Intervention Review Workgroup members. Everyone is listed here, and we just want to thank everyone for all of their time and expertise and guidance. They all worked hard on developing the intervention submission tool and the review tool. So we're certainly grateful for the efforts of this group. So now I'm going to turn it back over to Daniela, and we can do the question and answer section.
Thank you so much, Tracy. And thanks to you all who have already submitted your questions. Please go ahead and use the Q&A box on the bottom of your screen to submit your questions. So the first one we're going to address is, does the character limit include spaces? And I'm going to ask this to Claire, who manages the technicality portion of the Qualtrics survey.
That's a great question. I want to say yes. I'm not 100% sure, so I will send that as a follow-up to this webinar. But I'm pretty sure the spaces count.
Thanks, Claire. The next question is about reach. So this is for you, Tracy. Can reach be an annual number?
So yeah, oftentimes I think reach is just reported in terms of, the total number of people reached within a year or whatnot. I think if it's possible to look at what I had touched on earlier about those that were actually reached versus ideally reached can just be helpful in terms of learning more information in terms of if your intervention reached those that you had sought out to reach. So if you can dig a little bit deeper and look at some of those things that we talked about, I think that just would provide the reviewer with a little bit more information in terms of if those that you reached are actually representative of the target population. Then I would just try to do so if you're able to.
Thanks, Tracy. The next question is, I'm working on developing a curriculum for senior adults. Will this be considered as an intervention? I would say that if you're in the development and planning portion of this, that it's not quite an intervention until you can implement it and answer some of the dimensions that Tracy went over. So once you implement the curriculum with your seniors, then and use some evaluation metrics, then I would consider submitting it either this year or next once you're ready. The next question is, will this webinar be able to review later? Yes, we are recording this webinar, and you'll be able to access the recording on the SnapEd Toolkit website. The next question is, can you, people are looking for the REAIM table on the previous slide, so we can answer that in the chat link. What if you missed the January 7th submission? That's perfectly fine. The submission dates are the 7th through March 1st. So we won't close the portal until March 1st. So you have a good month to submit your intervention. Can you submit multiple interventions? Yes, but you'll have to request one application link per intervention. So remember that each application link is discrete. Can you save responses using the online form and come back to it? Yes, you can. So just use the unique link that you were sent via email, and you can just pause and come back to it once you're ready to submit your final version. Oh, it looks like there's some new questions.
While we're looking at the new ones, I just wanted to close the loop on I just wanted to confirm that spaces are included in the character limit. And we just chatted out the direct link to the REAIM table. So that should be in the chat as well. And then I'll leave up the additional resources here so that people can see them or, navigate to them if they'd like.
Thank you, Claire. There's a question, will the slides also be shared with the recording? Yes, they will. So you'll see the recording and the slides on our website, on the SnapEd Toolkit website. Our organization has two interventions that sometimes overlap, work together. Is it best for us to submit applications for those interventions separately? Tracy, do you mind if I field this one to you?
Sure. That's a good question, and it's a little bit hard just in terms of not having enough information about the two interventions. I would say have a look maybe at where there's overlap, or if there's overlap in terms of the evaluation piece of it and the effectiveness piece. And if it kind of bolsters the evidence, if they're complementary, but still building the evidence for the intervention, then maybe they would be helpful to have together. This also may be, may be more helpful if we address it during an office hour or over an email. So, we'd be happy to work through that a little bit together, because I think perhaps having a little bit more information about the two might better guide my response.
Tracy, to follow up on that, how would you say we define intervention? And could it be the use of a tool process to conduct an assessment for a specific setting, like in schools, and then make a plan for a PSE change based on the results of the assessment?
That's a great question. So I think that could be something that could be submitted. It may also be something that we could get some more input from Lisa Mays on, but also just I encourage the person asking the question to have a look on the SnapEd Toolkit list of interventions now, and just to get a sense of if their intervention, they may see something that's somewhat parallel there to what their intervention or project or whatnot is, that may be helpful to give them some more guidance on that.
Thank you, Tracy. I have another one for you. If submitting an environmental assessment, can reach be the number of eligible agencies reached, or does it need to be at the individual level?
If I'm understanding correctly, I think yes, that would be fine. If that is the mechanism that is to be used to reach those individuals or the target population, then I think that would be fine to include as your reach. Again, may also be a good one just to send to the SnapEd Toolkit email address there, or stop in the office hours and we can talk through it a little bit more. It's just a little bit harder to give a well-informed answer without all of the details. but I'm happy to provide additional guidance if we can get more information.
Thanks, Tracy. The next question is, will the government shutdown affect the timeline in any way? That's also a great question, and I'll say that it will not affect the submission timeline. So we're still just, the portal to submit is open, and it will be open until March 1st. If by that point the government isn't open, it might affect the reviewer pool that we have, because some of our reviewers are government workers, and so that might become tricky, but we don't want to really make any decisions on that until we cross that bridge. So I would say for now, the close deadline for March 1st on submitting interventions will not be affected by the government shutdown.
And we'll provide updates if we have any of, if we think that will affect the timeline, we will. But I think Danielle is absolutely right. The March 1st deadline will be relatively will not be touched by the shutdown.
And the SnapEd Toolkit website will not be affected by the shutdown, and neither will our office hours. So those are all things that our team at UNC manages. So luckily we are up and working. If our program has multiple components like physical activity, healthy eating, PSC, parent wellness, do we submit these as separate interventions? Or will it let us report outreach and outcomes for each component within one intervention? Or should we request a link for each component that has its own curriculum, for example? So I don't know if this is really a Claire or Tracy question, since it is technical, but it's also a content question. So either one, if you have insight on how to submit a multiple component intervention.
I'll let Tracy start.
Sure. So my sense is that you should be fine to submit it as one intervention. I think what it will just lead to is that you'll have probably maybe more intended outcomes than average, but there is the ability in the effectiveness section of the intervention submission form just to continue to add outcomes. And so you'll just have to address each of those components with their related outcomes. And so that just may be a longer section than others interventions, but I think it would be fine to include as one.
Yeah, that's a great point. We tried to create space to let people share more if they have more, not beyond the character limit, but like if you have 11 intended outcomes or something, there's an option to add more rows. But if your intervention is complex and has a lot of different components and you run out of room for that, just let us know, and then we can maybe add a few more lines to let you put those main outcomes or main objectives that you're looking at through the intervention.
Thank you, Claire and Tracy. So we do have someone who's raised their hand, and because we are not opening audio for participants, I'd like to ask that folks, instead of raising their hand, they just enter their question into the Q&A box. But other than that, I think we've answered all the questions today, but I really encourage folks to visit our office hours. It's 1 hour, and the three of us are on call to answer your most nuanced and complicated questions. We really have that opportunity to go in deep with you and think through just the types of questions you are asking. And we have them every Thursday, starting last week, that's right, and it's ending the 28th of February. So we have quite a few sessions, so feel free to come to all of them if you want to just kind of think out loud with us. And we're happy just to provide support in that way. You can also email us again at snapedtoolkit@unc.edu, and we could send you links, or we could talk more elaborately about your intervention. So we're happy to help on any level of your question.
Yep. Great. And just to let folks know, for the ones that we didn't I think we verbally talked about most questions, but if we were referencing links or timelines, we added those as answered questions too. So if you didn't hear your question, just make sure it's there. But I think we chatted through most of them.
Great. And so please take a look at the chat box to see some of these links.
Yeah, great. Yeah, well, thank you guys so much for joining. Thank you, Daniela and Tracy, and we have our colleague Julia here helping run the chat function and Q&A. So thank you to my colleagues for hosting this webinar. We are really excited to kind of see the interventions come in, provide technical support as needed. So as Daniela mentioned, please feel free to use all or some of these venues to get your answers or your questions answered, or just to talk through it with us. We want to be as available as possible. So we will be available, and we will hope to hear from you soon. So thank you so much.